Have you been injured, told that you have a disc herniation and don't know what to do next? Don't worry, you're not alone. Hi, this is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation. I'm fellowship trained in primary spine care. In addition to my training, education, and experience, I have decades of helping patients with disc herniation. So we are going to go over some common questions. In fact, this is part 2 of a 4-part series. Now, I want you to remember that this is not a substitute for medical or chiropractic advice, diagnosis, treatment, or anything along those lines. This is strictly for educational purposes, and this is for information. So, this is part 2. In part 1, we discussed what's normal. In part 2, we're now going to discuss what actually is a herniated disc. So before we get into what a herniated disc is, you have to realize that most disc herniations are diagnosed using MRIs, which stands for magnetic resonance imaging. The diagnosis of a herniated disc is a visual description of a deformity of disc material. Now, you can get a visual description, of course, through surgery, but for the most part, it's done through MRI. Because this is visual, this is how doctors classify it. And so I'm going to go over some of the basics behind that, but I want you to realize that I'm going to refer to a very well-known research article. It's written by Dr. Fardone. It is public domain. It's freely available on websites anywhere. So you can go download it yourself if you really want to see what the radiologist who read the MRI is describing. So first, what is a herniation? I'm going to use my model over here. A herniation is where this disc loses its normal regular kidney shape. So right now we're looking from the top down, and you can kind of see how that's kind of a kidney shape, and where the material starts to stick out. So we want to kind of talk about how does that happen? You know, it's very uncommon for us to have patients that come in where the disc spontaneously herniates. Does it happen? In certain circumstances it can. But the vast majority of the time, patients will relate to us. They know exactly when the disc herniated. And it's because the discs are not supposed to do that. So there's some sort of force delivery, some sort of traumatic force that happens that injures the disc. Now, anything is capable of injuring human tissue if the force delivered to the tissue exceeds the tolerance of that tissue. For example, let's just take a twig and take a branch out that you can see out in your yard. If the branch is really brittle, it takes less force to snap it versus if it's a plump green one still attached to the tree. There is a lot more force that is required to deform that branch that's green versus the one that's brittle. Less force, more damage, the more brittle it is. And that's really what degeneration is. So that's a common risk factor. So if somebody has degenerated tissue, the tolerance goes down, it takes less force to create more damage. So that's kind of in a broad nutshell how you take a look at degeneration. So a degenerated disc is more brittle. However, that being said, even a very young, healthy disc, if it's hit with enough force from the wrong angle at the right time, it can tear and then it can herniate. So let's talk about this. What ends up happening is this circular fiber that constrains and restrains the soft jelly donut called the nucleus on the inside, it suffers a tear. And the tear can go with the fibers, it can go cross fibers, it can be internal. In fact, I've got the research paper right here. I'm just going to show you. This right here is a sideways view of the disc, and you can kind of see how that inside dark material pictured with the artist, how it starts to move backwards. And that was, once again, a sideways view of this segment right here. So what happens is that there's a tear, and then that material, the soft nucleus on the inside, migrates through there. The disc now deforms. There are 3 types of disc herniations described in this paper. There are 3 types of disc herniations that radiologists usually will describe. The first, and they're increasingly more severe as I describe them to you. The first one is called a protrusion. The second one is called an extrusion. And the third one is called a sequestered disc. So I'll just show you the pictures really quick so you can understand it. So first of all, this is a focal disc herniation. It's a small one, but small doesn't mean it's not painful. But you can see it's small compared to a broad-based one that's up here. You can see how that material is very localized and it's deformed and it's moving away. Once again, here's another picture. So you can see how this is a protrusion. It's a focal defect in the disc. This one right here looks like a balloon, looks like part of that nucleus on the inside is trying to escape. And then not pictured there, but you can visualize it. A sequestered disc is where that balloon has escaped and it's now a free-floating fragment. Those are very, very challenging to manage conservatively. I can tell you that firsthand. So, going back to the earlier model that I used, this one is way more detailed than the simple bone and disc model. You see this yellow right here? That's a ligament, ligamentum flavum. You see this joint? Joints are where you have two bone surfaces that are covered with ligaments. This is a healthy joint capsule. This one right here is an injured one. Well, in addition to these ligaments, not pictured here, but in real life, there's multiple ligaments. So these bones are held together with connective tissue. The connective tissue is the ligaments, very similar to if you sprain your ankle, you sprain the ligaments. We have ligaments in the spine. And the disc also is a piece of connective tissue also. What ends up happening is you can tear, when there's traumatic force, you can tear through those tissues. Now, I'm going to show you right here, you can see on the side that there is a red defect right there in that disc. That red defect is to picture that there's been a tear. What can end up happening is that you can kind of see how that material can start to leak out. So once that material starts to leak out, it can create problems. So first of all, as we talked about in the initial video where we talked about what is normal, the disc itself is alive. The disc itself has its own nerve endings. So the disc itself can be painful. That's called discogenic. The word genics comes from the word genesis, meaning origin. So you can have disc pain. That's oftentimes localized right in the region. So if it's a disc herniation in the neck, disc herniation in the lower back, you can have localized pain there. Another source of pain that's very common is if that disc material is pressing on one of the surrounding nerves. Because remember, the spine, while it's a movable skeleton, it also provides a bony protection around much of the body's nervous system. So there's nerves close by, and there can be direct compression on that. Last but not least, the disc tear itself can oftentimes produce inflammation. So there can be inflammation that can be producing pain. Now, in more severe cases, the disc can tear and then some of the fluid can leak out, and that is considered toxic to a lot of the tissue surrounding it. And so you can have a chemical burning pain, you can have a chemical type of pain in addition to the actual inflammation surrounding all the tissues in that area. So once again, you can have pain in the disc. From the disc herniation, you can have pain if the disc herniation is mechanically, physically pressing on the nerve. You can sometimes see that on MRI. Or if the disc herniation moves onto the nerve, off the nerve, if it's a smaller one. So depending on the different position that you have, that nerve can be affected. The disc itself can be leaking fluid, that can be a source of pain. Also, the inflammation from the traumatic force, if there's surrounding inflammation that hurt the ligaments and the muscles, once again, there can be surrounding inflammation from that. Finally, the normal disc distributes weight across the whole, what's called motion segment. There is, in the lumbar spine, low back, approximately 80-90% of the weight is on the disc, 10 to 20 is on the joints. When that disc material leaks out, it kind of keeps the disc space that's supposed to be jacked open, that disc space now collapses. So what can happen is that the joints on the back start to compress on themselves because that spacer element of the disc is now gone. So not only is the disc injured, the disc space collapses, and now the joints are grinding on each other. And that's an additional source of pain. So that's a very common thing that we see with our patients that come in. Last but not least, if the traumatic force, let's say it's from a motor vehicle crash, is like a blast of energy that goes through, not only can you have the blast of energy injure the muscles and the ligaments as it's passing through the spine, it then hurts the joints, it hurts the disc. So now you have injured muscles, injured ligaments, injured joints, disc injury, disc herniates, comes out, space is deformed, The disc is deformed, space collapses, and now these injured joints are now grinding on each other. It's a very, very unhappy situation, and that can be an additional source of pain. So that's why it's very important as a doctor of chiropractic and almost any doctor that's going to be taking care of patients with disc herniations that they understand the anatomy. They understand what normal is. They understand what abnormal is. They understand the significance of more than one pain generator in or around the disc herniation, because all of those pain generators do need to be addressed. So I hope for educational purposes this helped you. You could listen to anybody. You chose to listen to me, and for that I'm honored and I really appreciate that. Remember, once again, this is for educational purposes only, not diagnostic. Thank you so much for listening. Be blessed.